What's up, guys? Dr. Jared Hall here, physical therapist in Fort Worth, Texas, and I wanted to talk about a crazy study that just got published in the Journal of Science by Tinnerman et al. And what this study showed is that the nocebo effect is actually intensified by the price of a medication or the price of an intervention or the price of a examination technique. Now, in this study, they looked at the price of a medication, and when patients were given an inert medication or essentially sugar pills, but they were told that it was really expensive and they were told that it might have some side effects, patients reported more intensified side effects and symptoms as a result of taking a sugar pill that was more expensive. So to put that in perspective, if somebody took a sugar pill that said it might have the side effect of a headache, if the sugar pill was $1, they might have a little headache. If the sugar pill was $1,000, they might have a really big headache because the price of the intervention can actually modify early pain processing or the perception of pain or the experience of pain that your brain creates in response to a treatment that is not supposed to do anything. So if we take this and cautiously generalize it to other things in the medical field, like, I don't know, let's say diagnostic imaging, if you spend a ton of money on a really expensive MRI that shows you some findings that are age-related degenerative changes, but you know that you spent a lot of money on this and you know that it was an invasive technique, you had to lay in a tube for 45 minutes and it showed you every detail of the inside of your body, the nocebo effect could be dramatically magnified over some other less expensive, less invasive intervention or test. So we have to be super cautious of the interventions and tests that we're running on patients. We have to realize that just like we know the placebo effect is a very real thing, the nocebo effect is also a very real thing. And in fact, in most studies, it's shown to be more powerful and have longer lasting effects than the placebo effect. Yes, a sugar pill or something that has no clinical value at all can cause effects, and it can be both positive and negative. So spread this message around and think about this when you're applying treatments. Think about this when your patient has had a treatment or diagnostic imaging or some sort of diagnostic examination. Understand that there are effects that could occur that have absolutely nothing to do with the biological processes going on in the person's body or the tissue damage or whatever it may be that they're there to see you for. This could be very neurophysiological, and it could be pain processing issues and nothing to do with the tissues. So I hope you guys spread this message around and comment down below with any questions. Thanks. Have an awesome weekend.